Welcome back. We are back with Dr. Grant, who works at Cone Health, and she's got all these great pieces of information for us today as we navigate through this pandemic. The next topic I'd like to discuss, Dr. Grant, is the controversial topic of wearing a mask. I don't know about you, but just about everywhere I go, people are wearing masks. I see people wearing masks incorrectly. Why is it so important that you wear it the way that it's intended?
Well, as I was mentioning earlier, if I'm talking with you and I laugh or I sneeze, things come out of my nose and my mouth, and that is what gets onto you and gives you the COVID virus. So if you cover the nose and you cover the mouth and you make sure it's tight against your mouth, then you are protecting yourself from somebody else's cough, and likewise, you are not giving your cough to someone else. So really wearing it over the nose and the mouth is so very important, Chad. And when you're talking, don't pull it down. That's the important time, because you don't know how many particles come out of your mouth when you're talking. So putting something over those is really what is key to not spreading this virus and colds in general, but particularly for this virus.
Over the past few weeks, really since the emergence of the Omicron variant, we've seen a lot of people, and we've heard from a lot of people in the healthcare profession saying don't go to the emergency room if you need a COVID test or if you have slight or mild COVID symptoms. Why is that so important?
Well, we want everyone to go to the emergency room if they're having an emergency, a heart attack, if they're having a stroke, if they've been in an accident. All those things take up our emergency room beds. So it's really important that we have the right beds for the right patients. So if you're just having symptoms of cold and you're having symptoms of this COVID virus, then those are the times just to get tested or do a virtual visit. We've started offering so many virtual visits now through our system and almost all systems now. So you can go to conehealth.com and there's a place right there that says virtual visit. So if you're not sure, get online with a provider and they'll talk you through whether you really need to be seen at your office or at our respiratory clinics, which we have now, or if you really need to get to urgent care or to the ED, but not for testing. That is not how you want to use up a bed that might be needed for something else.
And I imagine a teledoc visit is much cheaper than going to the emergency room, depending on what happens.
Absolutely. And most of our insurances now, especially during this period, do cover that. So your insurance will cover that. And then there are many options under there just for COVID, conversations that don't even have a charge associated with them. So go to conehealth.com, virtual visit, and it will help you go right through that very quickly. And then likewise, your doctor's offices, many of them now are doing virtual visits, and that fee again is charged to your insurance. So just like if you were going to the doctor's office. So don't be afraid to connect with your primary care physician or one of our respiratory clinics and get that cared for without going to the ED and getting that kind of fee there, which the charges are much higher because those are emergency level services.
A lot of people are now also accustomed to the term COVID-19 long hauler. What does it mean, and how long does someone have to have symptoms to be considered a long hauler?
Yeah, the long haulers, for most of us, if you're having COVID and you have respiratory difficulty from any other disease or you have cardiac difficulty, you may be a long hauler and have this disease. But very healthy people now with COVID have also become long haulers. It just means you're still having side effects from this virus for a long time. You're having difficulty and walking and having shortness of breath. You have other conditions that are making you feel so worn out and tired. That's a long hauler. It just means this virus is staying in your body, is continuing to make you not able to function the way you should be able to function. And for that, we have respiratory clinics. So we actually have respiratory clinics, and other counties do as well. But that's available for you, for someone that's had COVID. They thought they should be over it by now. They've gone to their doctor. They're still feeling poor. They can get into our respiratory clinics, and that's where their long haulers can be managed with some different kinds of medications and different kinds of treatments.
I don't know about you, but a lot of people in my circle seem to have, I guess, the worst long haul symptom is either the loss of taste or smell hasn't returned. Is this something that could continue forever? I mean, how does that work?
You know, this is still an early disease, right? We don't know what the forever is at this point. And so I think that there are people who've had the disease and it has been, you know, a long time, like a year, and they still don't have that sense of taste back. But again, I think getting to these physicians and providers who are really used to managing that disease for the long term can be beneficial to them, and they can answer more of those questions individually based on your indications of what's going on with you. So I would say get to your physician and get referred to one of those long haul clinics so they can give you more information and education.
Have you heard much data coming out about whether there are treatments for those types of conditions, I suppose, the loss of taste or smell over time?
I don't know that there's a solution to that specific one. I think it's more the fatigue ones, it's the difficulty breathing, those kinds of things, immobility, you know, not being able to function and get around the way you used to. Those where there's a lot more treatments for that. But I would be truthful to say I don't know that I've heard of a treatment for the return of taste. Be glad to look into that for you, Chad, but I do not know.
I just feel bad for all my friends who can't smell their food anymore or taste it.
Yeah, and they probably were vaccinated too. So it's sort of like, you know, you don't know what early on the disease, we didn't have the vaccines, and now we do. And we know so much about it. And we just know that the right thing to do is get your vaccine, you know, wash your hands, stay away from each other, wear your mask, just the things we've been talking about from the very beginning, so we can kind of beat this virus and get over this.
Maybe you've seen this too. The World Health Organization recently said the rapid spread of Omicron offers what they're calling plausible hope for a return to normalcy soon, but that we shouldn't lower our guard just yet. What would you say contributes to this sense of optimism that we're seeing?
Omicron is a fast-acting variant, so as we know, as diseases live in our bodies and they continue to change, they metamorph, they change, they become a variant, and that's what Omicron is. It seems to be a faster one, that it really kind of gets people sick in 2 to 3 days, and then you seem to get over it by that 7th to 8th day that you're feeling better. So it gets over you faster. So I think that's what they're saying. If more people are getting it and that spread is there, and we get people vaccinated, in Guilford County, we're still at 59% that vaccinated. So the two of those coming together means we might get that, but you don't know what the next variant's going to be. And so that's why we say it's important right now to get this done, because the spread of Omicron has just filled up our hospitals. We're at the highest census we've ever been at during this COVID 2-year battle. And so that shows that Omicron has serious side effects for those people that may have other chronic conditions as well. So, it's not good just to be spreading it. That is not what we need to do. We need to wear our mask and try to fight this disease and get beyond it.
All right, Dr. Grant, we've got 2 sections down, 1 more to go. She'll be answering your questions for another couple of minutes, so text them to us. The number, 336-379-5775. We'll be right back.